Title Podcast. I'm your host, Bruce Outridge. This is episode number 232 if you're listening to us on the podcast. And today we are going to talk about your health. We're going to talk about driver health with Dr. Nadine Plummer. Now, Dr. Nadine Plummer is a naturopathic medicine doctor focusing on weight loss. We're going to talk to her about what you can do to be healthier as a truck driver and how you can select and get yourself in better shape so that you're around for a long time. So stay tuned, and we're going to be right back with Dr. Nadine Plummer. All right, so we have Dr. Nadine Plummer with us today. How are we doing, Nadine?
I'm doing well. How are you?
Good, good. So we are going to talk about all things trucking, but tell us a little bit about you. And you're a naturopathic doctor. So explain what that is, because us truck drivers don't know what that is.
So I'm a naturopathic doctor. Naturopathic doctors are licensed doctors in the province of Ontario.
Okay.
I did a 4-year naturopathic medical course.
Right.
To become a naturopathic doctor. So just like traditional allopathic doctors, we study science, biochemistry, organic chemistry, pathophysiology, anatomy, etc. The exact same thing as traditional doctors.
Right.
But our approach to treatment is quite different.
Okay, so explain how that might be different.
Okay.
You're not going to give me a pill, I assume?
I might. In Ontario, actually, we're limited as to the pharmaceuticals that we can prescribe.
Okay.
It changes a little bit per province in Canada.
Right.
In British Columbia, naturopathic doctors also have a pad, and they prescribe pharmaceuticals, just like an allopathic or traditional doctor. So basically, the approach here is quite different. So we use different tools, like we might use acupuncture, Chinese medicine, botanical medicine, herbal medicine, a lot of supplements.
Okay.
Some naturopathic doctors choose to use homeopathy.
You're using all the big words. You're going to lose the whole audience, right?
So we focus a lot, mainly though, on diet, lifestyle, nutrition.
Okay.
And then when those things aren't working, then we bring in nutraceuticals, for example, supplements.
Right.
And then after that, it's kind of open. It depends on what that doctor likes to use.
Okay.
I like acupuncture and I like supplements.
All right. So your business focuses on basically losing weight and being fit, right? Acupuncture, and then
So different naturopathic doctors choose to focus on different conditions.
Right.
So we are trained as general practitioners, so we see basically all the same conditions that your family doctor would see.
Right.
But actually, I can't say the word specialize. I could say emphasis. So some people choose to have a special focus or emphasis on particular conditions.
Right.
For me, I'm interested in weight loss.
Okay.
I also work a lot with patients on stress management.
Okay.
And I do have extra certification in a few things, in facial rejuvenation acupuncture, which is cosmetic acupuncture. I have special training in counseling, health psychology, because I think that plays into many different conditions.
Right.
So after I graduated, I chose to do a few extra certifications, including being certified as a personal trainer. Just because I've always been interested in athletics. So you've got a real strong spot in that. So tell us because the two things that you mentioned, the weight loss and the stress, are the audience is truck drivers, right? That's probably the biggest thing to them. How do the two of those, like if you're, some people overeat because they're stressed, and some people are stressing because they're overweight. So how do the two go together? Like, how do you see them? Is there a way of separating them, or are they always together? Or? I think they're often together. One of the other things that's a little bit different about naturopathic doctors is we don't just treat symptoms. We try to get to the root cause, and we approach each person as a holistic being, let's say, so as a person whose emotions and as well as their physical body, as well as their spiritual aspect, mental, emotional, physical, they all come together to create that condition. So I think all those elements are often involved. Some people might not have as strong a spiritual belief. I do have a master's degree in theology and began a PhD in theology, including a neuroplastic element to it.
So you're pretty smart.
So I bring that background, and if a patient chooses to incorporate that, they can. But basically with the mind, the mental, and the emotional, those really often come into play with stress, and they come into play with weight loss, and the relationship between those two is often when people are stressed, they tend to eat more, and then they gain weight. But there's also a chemical relationship between that. When you're stressed out, then your body flips into more of a sympathetic nervous system condition, which you're going to say nobody knows what that means. But basically, most people are familiar with the ideas of fight or flight, right? So when you're stressed out, you go into the fight mode.
Right.
And when you go into fight mode, your heart rate accelerates, your body pumps out a bunch of adrenaline as well as cortisol, so that you're prepared. Like if you're trucking and it's heavy traffic and you're getting, like, let's say, angry and you have to deal with the traffic and you've got time restrictions, you're probably going to be stressed out. And whether you know it or not, your body's responding, more adrenaline's being pumped out. And the cortisol that is pumped out actually causes your body to retain fat. And it causes that fat to gather around the abdominal area, so it covers the visceral organs. Let's say the abdominal area. That puts you at risk for heart disease. So kind of everything ties in a little bit. So if you're not treating the stress element, especially for truck drivers, then you're not really going to be doing justice in treating the